One of the most significant things that came out of my stent surgery that was probably the most instantaneous difference that I noticed, because I had coworkers and other people ask me this, and I want to share because I'm sure other people in the IIH community can probably relate to this. So comment down below if you have had the stent surgery and you can relate to this. But basically, one of the first things I noticed, probably within just a few days after my stent surgery, was just the silence. Imagine, the best way I can describe it is, imagine when you have like an air conditioner unit and your brain kind of cancels the noise out because it's just always there in the background. But you notice when the air conditioner turns off, or you notice when it flips off, right? That's how I would describe the feeling of not having that whooshing sound in my ears, aka the pulsatile tinnitus. That was one of the first things that I noticed when I came home after my surgery. I remember one time just like sitting there, and I was like, I realized I hear nothing. Like absolutely nothing. No whooshing in my ears. It was like somebody flipped off the air conditioner unit. And it's weird because it's funny because it's taken me a while to adjust to that, in a sense, because now I'm like hearing all these other noises, and at times it almost feels overstimulating to hear all these other noises that had kind of been in the background more because of the whooshing sound in my ears. I had that whooshing sound in my ears since I was a child, and I never had pain. I never had any changes in my vision, but it was like, as a kid, I never questioned that that was unusual or abnormal. I thought everybody got that. And it came to my realization as an adult from talking to my doctor. He explained the mechanics of what that noise was, that it's basically you have those narrowed veins or those narrowed arteries, and the blood moving through those narrowed veins is what creates that whooshing sound in your ear. And so because the stenosis is like in that the transverse sinus and sigmoid sinus, which kind of runs kind of near like behind the ear area, I was hearing that whooshing sound there because it was like right there by my ears. It was those narrowed veins, and it was the blood moving through those narrowed veins. And so it's just crazy now not hearing that at all. The sound of silence. Maybe one day I'll share the poem that I wrote about that on here. Comment below if you want to hear that poem. Sound of Silence. The title of the poem's not called The Sound of Silence. It's called Praise Under Pressure, which is the same name as my YouTube channel, basically. But anyways, I wanted to share that too, just as a follow-up, that sometimes you don't know something is there until it's not there. So I just wanted to give a quick update, almost 3-month update post stent surgery. I just wanted to let you guys know that I'm still here and I'm still alive. But I also wanted to come on here specifically because I wanted to share just kind of a very specific aspect of my pre-surgery kind of like evaluation, and kind of all of the different levels of blood tests and things that you have to kind of go through before you are cleared to have your stent surgery. So in my case, there were certain medications that I currently am on and started on about 10 days prior to my stent surgery. And so I'm actually going to explain the process of those medications just in a little bit more detail, because in my own research, reading through scientific articles concerning the medications that I'm on and different comparisons of the effectiveness of different medications that my doctor himself had mentioned, I just wanted to explain in simpler terms what that means, and also just for my fellow IIH community, if anyone on here follows who has IIH, I just want to be able to maybe help educate a little bit and be able to give you some advice that has helped me, maybe shed some light on things that are confusing for you. So here we go. So after I had the initial cerebral angiogram where they determined that I would be a good candidate for an actual stent, which is basically, other than the actual stent itself being put in, is basically the same. And then also, of course, I didn't stay overnight in a hospital, but basically, when I had my first cerebral angiogram, where they also deployed the temporary stent and retrieved it, this is going to be the next step after that, if that makes sense. So like a chronological timeline, so to speak. So there were a few blood tests that the doctor had ordered. So this was in between my first cerebral angiogram and the temporary stent deployment and retrieval. So there was about a month, maybe about a month or so between that and my actual surgery, where I actually had the stent put in. So there was a series of different blood tests to kind of look at the composition of my blood. And one of the specific blood tests that they did was looking for a specific enzyme that is, I guess, plays a critical role in being able to metabolize certain types of blood thinners that a doctor may prescribe prior to and after stent surgery. So basically, to just kind of break it down a little bit, so with blood thinners, there's a whole category and subcategory of blood thinners that does different things. They almost like the mechanics can vary. So not all blood thinners are the same. There are some blood thinners, specifically in my situation, that their function primarily is to basically make your platelets. So for reference, your platelets, one of their primary functions is to help your blood to clot. So basically, they do that by basically sticking together. With the medication that I am on currently and have been on since 10 days prior to my stent surgery, it's a medication specifically that makes your platelets less sticky. So it kind of almost makes them more slippery, is how it was explained to me by my doctor and by my nurses. So I'm just breaking that down again because I think it's important information to know. So one of the blood tests that I think was one of the most interesting blood tests that I had done prior to my stent surgery was a blood test that specifically looks for a enzyme called CYP2D6. I had no idea what this was, so this is just me I've done a lot of research, kind of deep diving into it, looking at scientific articles and just really basically learning, and then also talking to my doctor and asking questions, because that's what they're there for, you know, or that's what they should be there for. And thankfully at UC Irvine, the doctors, a lot of them are very, they really want to help educate their patients and teach them things. And I really appreciate that as a patient, because that helps lessen my anxiety a lot, to be able to understand what's going on and to know what's going on in my body, and it empowers me. So the CYP2D6 enzyme is a enzyme that is primarily produced in the liver, and basically it helps to break down certain medications in the body, so that they can then be basically like bioavailable. And so the reason why my doctor specifically requested this blood test was because, with regards to the initial medication that he was going to prescribe for me, the primary blood thinner, along with low-dose aspirin, was called Plavix. And Plavix, in order for it to be converted into its active form, or that's like bioavailable form, to be used in the body, it has to have this enzyme that I just mentioned basically go in and break it down. So, but some people have a genetic component where their body either doesn't produce any of this enzyme, or produces a very small amount of this enzyme. And so in my case, unfortunately, when they did the blood test for me, it was found that I am what they call, quote, a slow metabolizer. Basically, my body produces this enzyme, but in a very small amount. And so basically, if I were to take Plavix, it would potentially put me at risk for blood clots and other complications, because my body wouldn't be able to produce enough enzyme to break down the medication into its usable form. So alternately, after that blood test was done, my doctor then prescribed me another medication, an antiplatelet medication that I'm now currently on. I have been on now since 10 days prior to my surgery, and I have not had any complications. They say with blood thinners in general, you just want to be extra careful with, like, you can be more prone to bruising, which of course I have noticed that I bruise a little bit more easily than I normally would, but I'm not by any means like a clumsy person, and so that's not really, but I just, like, I'm extra, if more so anything, just more mentally aware of like how I move in spaces, and just like making sure that I don't knock into things or bump into things, just because like normally it might not form a bruise, but when you're on certain medications, it may be more likely to form a bruise because of the medication, if that makes sense. Also, with that being said, you know, it's also important with blood thinners to just be aware that you may bleed a little bit longer than you normally would. Say, like, if you have a nosebleed, it may take a little bit longer for the nosebleed to stop. So with that being said, since I'm already, because of allergies and stuff, I already tend to kind of already be careful with that. So, but one of the things that I already do on anyways, even prior to this, is I do sleep with a humidifier most nights. And just because I live in Southern California, it's dry, low humidity is a big thing certain times of the year. So I just sleep with a humidifier, because it just helps me with my allergies in general, and it also prevents nosebleeds most of the time for me. And then I have other things too that I take just to help with sinus issues that also can help prevent dryness. So anyways, all that being said, it's interesting to me because in reading scientific articles comparing the antiplatelet medication that I'm on with Plavix, it's actually saying that Plavix is actually seems to be less effective, clinically speaking, less effective than the medication that I'm on. And that they actually are saying that the medication that I'm on is actually seems to be better for preventing blood clots in the stents and things like that. So I just feel really good about that, but I just wanted to come on here and just share that little tidbit of information regarding the genetic components that can sometimes contribute to why doctors prescribe certain medications and not others. As a patient, I think that it's important for us to be educated about our own care, and don't ask questions of your doctors, ask questions to the nurses and the residents, but then also too educate yourself independently as well. Find scientific articles and read scientific articles about things, and find reputable sources. And if there's a word or a phrase or a term that you don't understand, look it up and find out what it means. I think that that's so important as a patient, and just in general for people. If you want to understand something, if you want to learn something, we have so much information at our fingertips if we're just willing to put in the work and to be discerning about the sources that we go to. Wikipedia, probably not the best source. When it comes to medical stuff, I would always go towards the route of a scientific article, where that it's reviewed by people in the field that know what they're talking about. And so, yeah, I just wanted to share that because I think that education is a gateway into helping patients to not be as anxious about their own health. And the less anxious we are about our own health, the more we're able to, I think, trust doctors. And obviously there are good doctors and there's bad doctors out there because there's humans. But I think that as patients, when we can know that what our doctors are actually talking about and we're not in the dark about it, it helps us to actually trust our doctors more and to build that relationship between the patient. So yeah, that's all I wanted to say. Thank you.